each countries have their trend, but we have more than 30 devices, as I mentioned, so we can meet each country's demand. So today, Dr. Anna will discuss about the Lavieen more, and then its great performance and then many indications. So I can show you the several marketing materials from Brazil and then Poland and then other countries. And I believe many of the doctors today are also interested in our lifting device, Oligio. So after Lavieen, we'd like to have another webinar with Oligio. So thank you for listening my brief introduction, and then I'd like to take over my mic to Dr. Anna now. Thank you.
Hello, everyone. I just need a couple of seconds to share my screen. Can you see my screen now?
Yes.
Yes, okay. Thank you. Thank you for this introduction. And welcome to our webinar about Thulium Lavieen laser, which is a bestseller. And I know why, because it's very, very good equipment. I want to share with you my experience today. But first, I want to introduce myself. My name is Anna Płatkowska. I'm dermatologist in Poland. I'm also venerologist, dermasurgeon, and aesthetic dermatology practitioner. I have more than 12 years of experience in dermatology, dermasurgery, aesthetic medicine. I'm master of aesthetic medicine. And also, I'm working with many companies doing the clinical trials. And also, I'm international opinion leader for medical devices and also lasers. You can find me via Instagram as well. Okay, so today we're going to talk about 9027 nanometer laser, and I want to talk with you about the laser itself as an equipment, but I want to share with you my experience and some knowledge about dermatology and how we can use Lavieen with dermatological patients and also with some combined therapies, because we have so many opportunities to make the treatment more effective for our patients. Thulium laser is a type of laser which is based on the chemical element which is thulium. That's why we named it that way. The thulium is used in medicine, particularly in dermatology and aesthetic treatments. And the thulium generates laser radiation of a specific wavelength. It's around 9027 nanometer. It is making it useful in many procedures. We can improve the skin texture with thulium laser. We can treat the scars. We can treat wrinkles. We can treat pigmentation. But also we can use the laser for the stimulating of hair growth. This wavelength of the thulium laser allows for effective penetration into the skin and absorption by water in the tissues, resulting in gently heating, and it's very important, and stimulation of collagen production. Thulium laser can be used for non-invasive skin rejuvenation with minimal recovery time, which is very important for our patients in Poland today. Thanks to the 9027 nanometer, the Lavieen has 2 times higher level of water absorption than the erbium glass laser. So it will be working a little bit more effective than erbium laser, erbium glass laser. But at the same time, it has 24 times lower than CO2 laser water absorption. So it's like in between. It won't be very aggressive than the CO2 laser, and on the other hand, it will be a little bit more effective than erbium glass laser. With this Lavieen laser, we have a possibility to operate in 3 modes, and these 3 modes depends on the settings. So the first one is non-ablative. Non-ablative mode affects in the dermis, and we use it for rejuvenative treatments. There is no recovery period required, and the parameters are energy from 1 to 5 watt, and pulse duration we set from 100 to 500 milliseconds. Non-ablative mode we use for wrinkles, for skin texture improvement, for enlarged pores, for vitiligo treatment, and for hair growth stimulation, because we know that lower energy works very effectively for hair growth stimulation. And next one is subablative. At the left side, you have the histopathology, how it works via the skin. So subablative mode works like there is an interaction between the basal layer of the epidermis and the upper layer of the epidermis. So we have a little bit ablation and a little bit of coagulation, but we don't distract and we don't destroy the stratum corneum of the epidermis. So we have damage, but it's very minimal. We use subablative mode for the treatment of pigmentation lesions. I don't like maybe this term pigmentation lesions because as a dermatologist for me it's the other thing. It's like moles, generally speaking, so we don't use it for moles, we use it for melasma, for uneven skin texture. With subablative mode, the recovery time is very quick. It's like 1 to 3 days. To use that mode, we need to set up the energy from 6 to 8 watts and pulse duration from 600 to 1500. So we use the subablative mode to these indications like uneven skin color and also melasma. Sorry, I have some. I think you cannot see me, or maybe you can tell me if you see my face, because I get some message that you cannot see me, but I want you to see me during this webinar. But my camera is on, so I don't know where the problem is. Maybe you can change that. Oh, now you can see me. Okay, good. Okay, so it's better. So non-ablative, subablative, when we have a little bit of coagulation, for uneven skin color and for melasma. And ablative mode, so the third mode we can operate with. Ablation of the stratum corneum, denaturation of proteins, for treating the scars, for treating the stretch marks, which are the scars, definitely, and for deep skin remodeling. And here we have a recovery period more than 3 days. It can be more than 3 days. We set up the parameters for ablative mode, the energy from 9 to 10 watts, and pulse duration from 800 to 2000 milliseconds. Scars, stretch marks, deep remodeling. This is for these are the indications for ablative mode. So you have, like, if you have Lavieen, you have 3 lasers in one equipment, so it's like 3 in 1. You can work with non-ablative, not aggressive, with a recovery time. You can work with sub-ablative mode, and also you can do very serious, let's say, and you can do ablative treatments. And you can see here the changes in the epidermis and dermis under the influence of different modes of the laser. When you have the laser and you switch it on, a very important thing is the interface. And the Lavieen has very friendly interface. You can have the catalog of settings for different indications. You can adjust the shape of the laser to treat different parts of face or different shapes of lesions. You can also, of course, adjust the power, the duration of the impulse, the overlap, etc., etc. And you can also, when you have this need and you want to treat new things and invent your own treatments, you can save your own parameters to work with some kind of indications you have. The handpiece is very comfortable, and there is ability to adjust the treatment area of the face, neck, décolleté, and body. And also we have a roller for scalp treatment. And the very important thing is that you have no additional costs performing the treatment. So the laser is working, and you have no additional costs during the procedures. Of course, we all know that pre and post-treatment procedures are very important. I just want to shortly remind you some of them. We have to clean the face properly. The anesthesia is required. Cream and cold air. But cold air we use for subablative and ablative mode. For non-ablative mode, cold air is not necessary, and also is not good because we want to hit the skin. That's how the laser is working. So we are not prone to use the cold air. And of course, topical anesthesia, we leave at the skin about 30 minutes. We use eye protection for the physician and for the patient, of course. We set up the parameters, and we also set up the mode of working with the laser, stamping or continuous technique. For skin resurfacing, continuous technique is more adequate. For scars, stamping technique is more adequate. It's very important to remove the anesthetic cream and other substances before the procedure, and also to dry the skin surface. And of course, we remind the patients to be in a still position during the procedure. So we need to adjust the power of the laser during the procedure. And we have to maintain a close distance between the skin and the fractional handpiece. And what we do after the procedure is very important too, because we can mold this therapy more effectively. So also Lomtech provides the Lavieen post-treatment care, which is very good product because it contains the growth factors and it contains polynucleotides, which brings the hydration, helping us with the skin texture and also reduce inflammation. So the therapy will be more effective if you use the proper after treatment skin products. Of course, we can have redness and swelling for 1 or 2 days. Some scabs appears on the second or third day and fall off on the third or fourth day from the date of the procedure. Of course, we talk with the patient not to pick at the scabs. It's very important. And very important is also the hydration of the organism, not only moisturizing creams. We use only moisturizing creams, regenerative creams, and of course UV filter during the whole healing period. We talked with patients to avoid physical exertion, saunas, hot baths for 7 days after the Lavieen laser procedure, avoid drinking alcohol and smoking for 7 days after the Lavieen laser procedure. Normally, we set up the interval between treatments between 3 and 4 weeks, depending on the indications. Here we see a patient whose skin exhibits all the main applications of the Thulium laser, like wrinkles, like hyperpigmentation, like loss of elasticity. This is our perfect patient for Lavieen treatment. But also we use Lavieen treatment for hair loss, for hair stimulation. It works very effectively. I will show you publications about that. So now I want to talk with you about the skin problems, about a little bit about the dermatology indications and combining treatment, and refresh your knowledge about treating this type of indication, which may goes with the laser treatment combining with the dermatological treatment. So first group will be wrinkles, skin texture, and enlarged pores, and we call it signs of aging, which can be manifested in different ways. In aged skin, we can see wrinkles and fine lines on the face, of the neck, and of course they are appearing due to a combination of factors, including decreased collagen productions and also sun damage, which is very, very popular, especially in Europe, that the skin of our patient is very damaged by the sun. We can see in our patients sagging or loss of skin elasticity and uneven skin tone. And it was mentioned before that the Lavieen is like BB cream. It's true. It's true. I can assure you that. Some eye area changes in the skin, of course, volume and volume loss, muscle tone loss, of course, bone resorption is obvious, but it's not for laser treatment. Here on the left side, you can see the signs of aging, like thin skin, guttate hypomelanosis, aged skin like actinic keratosis. And of course, if we have patients with actinic keratosis or some pigmented lesions, the first step we have to do is dermoscopy or video dermoscopy. So we have to be sure that there is no malignancy on the area of the skin, because we want to work with the laser. So we have to do video dermoscopy first. But if we are sure that there is no malignancies, we can use Lavieen laser as well for these indications. And here you have before and after. After is the left slide, before is the right slide for enlarged pores, and it's only 1 week after the treatment. When you want to bring the holistic care to your patient, you have to combine the treatment. You cannot say that we do only the laser treatment and that's all. To be more adequate, to be more professional, you want to combine treatment with other things. Of course, what we want to have in cosmetics, or we want to combine with mesotherapy, we can use hyaluronic acid. We can use hyaluronic acid mesotherapy before the treatment to make the skin more hydrated, because the laser will be working more effectively after. And we can use hyaluronic acid after the treatment as well. We can use peptides, vitamin C. We can use topical retinoids. And also, as the last consensus was published, and we were talking about it in Poland during the last conference, dermatological conference, If you use also oral isotretinoin, you can do laser treatment for acne scars. So it's not like you cannot use it. Of course, you need. Of course, it depends of the dosage and it depends of the other condition. But remember that you can use topical retinoids before the treatment and after the treatment, of course, where the skin when the skin is healed, but also you can use oral isotretinoin and combine it with hyaluronic laser. Of course, growth factors like in the Lejuvi and niacinamide, which helps us with the post-inflammatory hyperpigmentations, and it works with the barrier function, and it helps us provide more elasticity to the skin. How we combined in my clinic Lavieen with other devices. You can combine it even in one treatment with infrared light, and it's very good combination. It works with the tightening, with reducing inflammation, and with overall skin texture. So it's like infrared lifting, let's say, and then we do that, and then we do laser Lavieen treatment. You can combine it very effectively with microneedling radio frequency. So you do the radio frequency microneedling first, and then you do laser Lavieen treatment at the same time. Okay, and of course we can combine it with LED therapy. Of course, everything depends on the indications of the patient status, and it's very you have to think very dermatologically and professional to do that, and to not to harm the patient. So sometimes you have to do these procedures separately, but some of them you can do also at the same time. And about the hair growth simulation, the hair growth simulation is very large and wide topic, and I just want to talk with you about some causes of hair loss. I'm sure that you know that. Of course, androgenic alopecia. It's very often. I think it's the most often thing in Poland, but it's not only androgenic alopecia in male, but also it's affecting female, and it's affecting more and more female in the last years. And of course, I would say that Lavieen is good for androgenic alopecia, and if you do only the treatment with the laser, everything will be good, because it's not true. But with this laser, we can stimulate the hair grow, and they're growing more fast. Of course, some hormonal changes, some medical conditions like dermatological medical conditions like alopecia areata or other skin problems can provide also the hair loss, stress and trauma, especially after 6 weeks, after the 6 months, sorry, after the trauma. We observe the hair loss in our patients, nutritional deficiencies. So there is a lot of conditions that can cause the hair loss. So the first thing we have to do dermoscopy, we have to do blood tests if they are required. It's very good to do trichoscopy if we can do that. And then think about systemic treatment, think about proper nutrition, and think about additional therapy, which can be made with Lavieen. Okay, so here I want to only remind you how we treat alopecia, androgenic alopecia. So in Poland we use minoxidil. We use minoxidil topically or orally, so systemic treatment with minoxidil, which makes hair grow very fast. For male we use finasteride, for female we use durasteride. And of course, there is always option for hair transplant, but we don't want to stop the hair loss and avoid that. For hormone therapy, we have to regulate the estrogen level in women. Of course, the thyroid gland is very, very important. Proper nutrition is very important also, such as iron, zinc, biotin, vitamin D supplementation, and also the proper diet. Dermatological examination is very crucial if we have seborrheic dermatitis, if we have FFA. So if we have some disorder in the hair follicles. So when we do that, then we can do the combined and laser treatment for that patients to make this recovery time, to make this treatment faster. So when I check the PubMed for Thulium laser and hair, we have only two trials. And I want to tell you about one of this trial from Dr. Tu. You can combine the Thulium laser with PRP, with mesotherapy, with vitamin cocktails, with topical treatment, and also with systemic treatment, as I said before. So in this trial, the patients had Thulium laser treatment with or without post-laser treatment application of a growing factor solution. So it was like split head treatment. So the one part of the hair was treated by with also post treatment growth factors, and the other side was not. And it was 12 sessions, and one session per week. Okay, and here you can see that the results are very nice. Of course, if you add to this treatment dermatological treatment, it would be even more effective. The next indication would be vitiligo, which is the most common depigmenting skin disorder, with the estimated prevalence of about 2% of the populations in adults and in children worldwide. And we all know patients with vitiligo. We know that it's a very huge problem, and it's very hard to treat, because we have the immunological system mistake that it destroys melanocytes. Also oxidative stress, some environmental factors, so nitrogenic factors and inflammation can cause vitiligo. And if you check the review of treatment of vitiligo, we have two types of treatment for non-segmental vitiligo and for segmental vitiligo. So the first line of treatment is for stable lesions, topical treatment with steroids, okay, or with calcineurin inhibitors. And also we can use systemic or mini pulse with steroids. For segmental vitiligo, sometimes surgical treatment is performed, and also UVB treatment with UVB light. But with the non-ablative laser like Lavieen, you can combine this treatment, this topical treatment, with laser treatment, because laser fractions are like opening to the skin for topical treatment, so it will be more effective. And I also check this PubMed publication for you about that. So we are not expecting that only laser treatment will provoke the pigmentation in the patient, but with combining this with glucocorticosteroids or calcineurin inhibitors, this will be more effective. Anti-melasma and uneven skin color be the effect of Lavieen laser. I think this is this indication which makes the Lavieen very famous around the world, because in my opinion is the one of the best modes of treating the melasma. We know that melasma is very common, it's very recurrent, it disturbs the patients, it occurs on the face, so the parts of the body which are very visible. Okay, and again, here we should do dermoscopy first to see if it's really melasma, if it's nothing malignant in the face. So we use many type of treatment to treat melasma, and also the laser is the more effective treatment. And if you check the Thulium laser in melasma on PubMed, you have a lot of publication about that. So it means it's very, very good and very, very effective. Okay. I search this publication. I check the publication for you. So one of the publication was with 100 patients, 2 treatments at 1 month intervals. And the results of this study was indicated that it's very safe and effective treatment option for melasma. So of course you can again combine this treatment with tranexamic acid topically or systemically, or with mesotherapy. You can combine this treatment with peelings, with salicylic glycolic acid. You can combine laser treatment with azelaic acid, retinoids, kojic acid, vitamin C, whatever you want to add to the skin via mesotherapy or via everyday cosmetic routine to the patient. So it works like in melasma. It works like we go to the dermis and epidermis, and we have exfoliation after 3 days. So the skin, it's not very irritated, it's not very red, it's not like it takes out of daily routine patients from the daily routine. It's like you would put the pepper on the skin. So it's, if the patient needs, she or he can put makeup and go to work. Okay, and so it's very gentle, and it's not very effective. It's not effective the daily routine. And scars and stretch marks, and this is also the indication which is very why the Lavieen is very famous in Poland. We know that with this type of lesions, we also want to combine the treatment. We want to work with Lavieen. We want to work with proper topical treatment. The same as I said about the wrinkles, we can combine this treatment with dermatological treatment. It's not depending of the type of the lesions or the type of the scars, because Lavieen will work effectively with many type of scars. Sometimes you have to combine the modes. So, for example, you use ablative modes and you use non-ablative modes. So you have to observe the patients because we want to do ablation, and at the same time we want to stimulate the collagen. And of course, I checked the publications for you, and the conclusion is like the Thulium laser is very good treatment for prevention of acne scars. And it's very effective. In my clinic, I combine the Lavieen laser with tropocollagen, with hyaluronic acid, with PRP, and you can combine it if you have keloid scars. You can combine it with triamcinolone, with steroid injections, or Listerine cream. So in summary, I want to show you again the photographs of histopathology and remind you the three modes of action of thulium laser. So depending of the mode, you will have three types of laser action. So you can adjust the mode to the indication to the problems your patient may have. 3-in-1, I think more than 3-in-1, very wide range of indications for Lavieen laser, like melasma, solar keratosis, which is actinic keratosis, hyperpigmentations. Even after one treatment, you can see your patient can see the results. You can simulate the collagen, you can reduce the wrinkles, you can reduce the scars, you can reduce the melanoma. So why do we need safe and effective technologies in our practice? The first thing is to provide modern treatment methods. We know that we need every year something new, something modern. We need new treatment methods. With Lavieen laser, you can provide faster therapeutic effects if you're a dermatologist and you're treating your patient the dermatological way. You can adjust the laser to your daily routine, daily therapies. It will be faster and more effectively. And of course, we want to take care of our patients in the best possible way, and we want to improve their quality of life. So this is our goal. This is the bibliography, and thank you very much. And now I want to check the question, and just give me a minute. I will check them, and I will try to answer them. Okay, I'm still here. I'm just checking the questions. The question was, it is okay to combine thulium with erbium glass at the same time? I think it can be a little bit more aggressive. I work also with erbium glass laser in my clinic, but I think I would do this separately. Regarding the parameters, we have prepared the procedures. I think one tech can provide you the strict parameters to every indication. How Lavieen work for hair loss? In my opinion, it looks good, but it would work better if the patient has also supplementation and even the topical treatment. It's a very good procedure for men because they are afraid of the needles and they don't want mesotherapy, and they are very, very gentle, and they don't want anything that is painful. How many procedures are needed in vitiligo patients? We don't know. There is no clinical studies for that. We don't know how many it would be like optimum. And I think this is a very good topic to indulge in it and to do the manual. Okay, there is a lot of questions, and let me check. Okay, if you combine the radiofrequency microneedle, you can do it at the same time, so one day. Okay, and I didn't observe any hyperpigmentation after the treatment. I didn't have any problems with that. For melasma, I do the treatment every 3 or 4 weeks. Is the same like the other indications. I didn't do. There is a question about exosomes, Lavieen class exosomes. I didn't do. This combined treatment. I think it depends if the exosomes are the type of exosomes. I think you can try to do that, like the fractional and then topical exosomes. There is a question about why Lavieen is effective for melasma. There is a specific hack for the treatment. No, we use the same we use the same handpiece. We only need to set up the mode, the special adequate mode. Yes, the Thulium Lavieen can be used for hyperpigmentation and for freckles also. Is Lavieen more effective than excimer laser? Which excimer laser is not very effective. As I said, speaking about vitiligo, even excimer laser is not like it's 100% effective for us, and there is no clinical trial to combine these two type of laser. But I think one tech company can do that in the future if you're interested in that. But I cannot say. Do we need cooling process for the skin right after Lavieen treatment? No, we don't need cooling process. We need adequate skincare after. That's why I was talking about Lejuve solutions. But of course, if you do very ablative treatment, so you just follow your imagination and do very aggressive treatment, of course, you should use the cooling mask. And I think if I remember good, they want to have very good cooling mask, right? This is the question for the company. But yes, if you do the ablative treatment, yes. If you do non-ablative, no. If you do no ablative, is not recommended. The mechanism for hair loss is like the small energy is making the hair follicles more nutrition, because we like open the veins of the vessels and it's stimulating in that way. For bikini lightening and for our genital lightening, I always set up 5 watts and not more than 5 watts. 5 watts is maximum, and I work with 500 milliseconds, but I'm not working stand. I'm working in a brush mode, which gives me more control and it provides a little bit less energy. Yes, you can treat all skin phototypes. What are the hair disorders that can be treated with Thulium laser? I was thinking about treating with Thulium laser the FFA. Because for this disorder, we don't have any good treatment. Of course, we use immunomodulation, we use methotrexate, we use cyclosporin sometimes. We use steroid injections, but sometimes there is very persistent, and maybe this is maybe we should try use the Thulium laser just to check if it will be effective. Why is laser not first choice in melasma treatment guideline? I don't know. I don't know. It depends of the country. I think there is not too much, not too big the group of the patient still. Uh, maybe it's a little bit politician thing, but we have to remember that it's not like in public healthcare there will be Thulium laser in every clinic. Even in the clinic when I'm working in, dermatological clinic, we don't have any laser. So I think the first choice for guidelines is the thing that is effective. It works with huge range group of the patients, and we have a clinical trials for that, and is very available. How is the ratio of customer satisfaction, and after how many sessions they can really find the results? With melasma, they can find results even after first session. I'll always do the photograph before, and I'll always do the photograph after 3 or 4 sessions, and then we're discussing about the results. If you work with eyelids, you need a protection for sure, but you can work, but very gentle. Lavieen can be used with Nd:YAG laser or DIVL or IPL laser at the same day for melasma. I think it would be a little bit too much. I will set up the interval about 1 week. First, do the Nd:YAG or IPL or DIVL laser, and then for the second part, I will do the laser Lavieen treatment. It would be very good, very good protocol. I didn't try Lavieen for dermatosis, but it's very worth to try it, because I didn't have in my private practice, I didn't have too much patience with that, but I think it could be very effective. But also we have to treat the cause of dermatosis at the same time, in order not to do the one thing with the laser, treating with the laser, and provoke it in a different way. We have to remember that melasma can always come back, and this is not permanent treatment, not one for life. We need to proper educate our patients, and it can go back. It can go back because the skin is a living organism. I think I answered more or less every question you have. If you have any additional questions, just contact with Montech, and the company will send me these questions, and I will prepare some resume for you if you wish. Thank you for having me. Thank you for the invitation, and I hope to see you soon.
Hi, Dr. Anna. Can you send me back to the
Okay.
office?
Yes. How I do that?
Yeah, perfect.
Uh, check the list of the
Panelist.
participants, and then you can. I will do this one. Nah, okay.
Yes, you
All right. All right.
did it
So,
by yourself.
guys, thank you so much for your time, and also we really appreciate your precious time, Dr. Anna, about your experience. And I believe that we have a very valuable and well learning time, and really appreciate about your experiences and different answers. And I would like to send you these questions on the list, and then we'll be very glad to have the answers by you. Then everyone in this webinar will happy to receive them.
Yes,
Okay.
let's do that.
So thank you so much for you guys. We would like to come back with a different webinar with maybe different product, where we will see how this next time. And I hope you guys will have a nice evening. Bye bye.
Okay, have a good
Thank
day. Bye
you.
bye.
Thank you.
수고하셨습니다. 근데 이거는 그냥 우리